Hello everyone, welcome to my channel. In this video I'll be talking about fistula. If anyone is suffering with fistula and they are thinking like surgery is the only option for them or bearing down the pain is the only option for them, don't think like that. Homeopathy can help you out, guys, because fistulas can be treated with the help of homeopathy. Wherever the fistula is there, almost the fissure is also kind of accompanied by the fistula. Fissure is a deep slip or an tearing of the skin. What is fistula? Fistula is abnormal passage, means like anus. Anus is a passage, it's a normal passage, and with the anus there will be an abnormal passage also, and that formation of abnormal passage is called as fistula. There are so many fistulas: fistula of anus, fistula near the ear, fistula near the parotid gland, uh, or fistula near the uh, means uh, near the umbilical cord. There are so many kinds of fistulas. Okay, we'll be talking about what are the homeopathic remedies which are really helpful in the treatment of fistula. Myself, Dr. Megha from Homeopathic Clinic. I am a practitioner of homeopathy from 5 years. First remedy which I will be talking about fistula is Calendula occasionalis. In my previous videos about calendula, I had already talked. Calendula is a medicine which is prepared from unflower, which has an healing properties. So here also it does the same thing. Fistula not healing properly may lead to this when applied locally. Means the fistula which is not healing properly, you can apply it externally. Means the mother tincture, 20 drops to an water or to an lukewarm water, effective medicine for healing. Lotion may be used externally always with other treatments also. If you are taking an allopathic treatment, you can also use the Calendula occasionalis cream or by external mother tincture, which can really help in the fistula closure. Next one is Calcarea carp. Fistula near the ear or fistula near the parotid gland. If there is a fistula near the ear, the patient will be very much suffering because of the ear discharge and a fistula discharge, and it is also visible to everyone. If it is in the anus or somewhere else, of course it's not visible, but when it is visible, of course the patient will be having so much kind of irritation and everything, and the patient is intolerable because of the discharge. That time you can think of Calcarea carb 33 times a day. Berberis vulgaris, this is also given in mother tincture form. Fistula of anus in mother tincture form means for the external application or the internal intake. For the internal intake, you should only go on with the pills form. Increase of bile secretion, then also you can give with the fistula, you can give the Berberis vulgaris. Sore erections, great itching of anus. Next one is causticum. Fistula and large piles. Because of fistula of anus, there are piles also, and fissure also accompanies with that, and there is piles which cannot be really kind of patient cannot take it to another stage, and there will be a suggestion for the surgery. And you can also give the causticum in the dental fistula when there is a fistula in the gum area. Okay, then also you can think of causticum. What potency the causticum should be given? If you ask for 200 potency, of course give it in a OD or 3 times a day. Next one is nitric acid. Nitric acid is a burning remedy. There are 1 or 2 openings, internal or external. This is very important. There is one or two opening, which may be one may be internal, one may be external opening. You does not know where the opening is. A soreness and burning pain in the lower bowel. It is also given in the anus fistula. But when you think of nitric acid, acids are burners, so the burning should be there. Soreness, burning is there. The open part is there. Of course, the soreness will be there, right? Soreness and burning in the lower bowel. Constant oozing of thin green matter from the fistula. Green matter. This is very important because in calcarea carb, as I already said, there is an yellow discharge, but in nitric acid there is a green discharge. This is the variation. This is the difference which you should be always observing when there is an remedy selection. Okay, constant oozing of thin. It is very important. Thin, not thick. Green matter from the fistula. It is a remedy for the first importance. Next one is silicia. Silicia always given for the any kind of skin rupture or any kind of skin which is divided and for the reunion. Abscess fistula. Mainly it is given for the abscess fistula. It may be accompanied with piles or it may not be also. Another one with accompanied with the larger piles is nitric acid. I already said. Give 3 doses in 1 day. Cures in 1 to 3 weeks. Give tuberculinum as an intercurrent remedy after the cure or during the standstill, like that. Silicia is a wonderful remedy, and silicia you don't need to wait for 200 potency. You can directly go for 1 m. If you feel like no, I'll be going with 30 only, go with 30 3 times 200. Next 2 days after 200, after that after 1 week go for 1 m, like that. Till 10 m or 50 millismol also you can prescribe silicia, because silicia does not kind of hurt the patient. Next one is sulfur. Blind fistula with cutting pains. These fistulas are blind fistulas, means that does not trouble the patient, but there is so much of pains, and fissures are also present with this kind of thing, and you can also see the piles, or with the piles or without the piles also you can give the sulfur. Next one is graphitis. Fistula of anus. There are so many anus fistula medicines only. If you are thinking, of course the fistula is affected, main part is the anus only. Sometimes, not sometimes, almost 70% it is also accompanied with the piles. The graphitis, fistula of anus, discharge, glutinous and very fetid kind of discharge is there, and it is also very offensive kind of thing. Graphitis is already, I had already mentioned, I had already done 2 to 3 videos on graphitis on the skin area. It is almost given in all kind of skin diseases. Okay, fistures, fistula, abscess, ulcers, boils, eczema, psoriasis, any kind of thing. If you see, the graphitis works wonders. Okay, you should keep the graphitis. Next one is bacillinum. It may be given when the other well selected remedies fail to cure. If you are thinking that nitric acid was the remedy for this patient, but it has stand still, or it is not working out, or you are unable to really kind of cure the disease, and it has come to 50% and it's not moving, then you can give the bacillinum, the same potency which you was giving the previous medicine, then the remedy works as wonders. This is one of the clinical tip which I always use. After that, you should, means after the intervention of the um, in the current remedy, you should start the main remedy. Means if you had given nitric acid and then you are giving bacillum, nitric acid 200 you was giving, then give bacillum 200, then also give the, after giving bacillum, again repeat the nitric acid 200, and if it is showing some improvement, go with nitric acid 1 m. Like that you should change the potency with the medications also. You can also give the tuberculum, but tuberculum and the bacillum both acts wonders, but which remedy, means which is the constitutional remedy, then only you can kind of decide which you should be giving. Both has given so much of good results for me in my clinical practice. Okay, I think I was able to convey all the information about the fistula and homeopathic treatment for the fistula. Thank you so much for watching. Please to like and subscribe, and don't forget to press on the bell icon so that whenever I put a new video you will be notified. Thank you so much, guys.